afternoon to everybody and welcome. My name is Sophia Gruskin and I direct the Institute on Inequalities in Global Health, half of the Institute on Inequalities in Global Health and the USC Law and Global Health collaboration. I want to welcome everybody here. The Law and Global Health collaboration has been working over the last several months at how to think about and how to begin to conceptualize the intersections between self-care interventions and the law. And we're going to be launching a large symposium and a kind of program of work in April, so stay tuned for that. But I think that we decided that in order to basically publicly launch this work, that the most appropriate person to do that would be Francine, in terms of being able to talk about these issues and help us to think about how to begin to conceptualize in relationship specifically to Plan C, but more broadly as well. Let me say a few things about Francine, if I may, before handing it over to her. Which is that she has been doing some of the most critical and impactful work, both domestically and internationally, really over the last 40 years, around different ways to conceptualize and ensure sexual and reproductive health services for people the world over. And she's a good friend, but she's someone I think that I consistently learn from when I look at the work and the kinds of things that she does. In 2018, she founded or co-founded Plan C, and I think she'll be talking to us about it in a variety of different ways. But what I would say again is that what is important from my perspective, personally, about Plan C, is that it's about a way of thinking about how do you publicly confront the restrictions that exist around abortion pills in the U.S. specifically, and how is it that you best advocate for better policies and for sharing materials to provide guidance and options, and that's something that very much resonates with the kinds of things that we're trying to do. I think the only other things before I hand over the floor to Francine is to say she is the co-founder of the Pro-Choice Alliance for Responsible Research. She serves on the boards of Engender Health and the Center for Genetics and Society. She has served on the state of California's Advisory Committee on Human Cloning, and in 2011 she was awarded the Lifetime Achievement Award from the American Public Health Association. So will you join me in giving Francine a very warm welcome?
Thank you, Sophia. It's really an honor to be here, and I have had so much fun thinking through what I was going to say to you. I've reframed it 6 times, and I don't know what's going to come out this time, but it's so exciting because the opportunity to give you an example, a very concrete example of this intersection of health, technologies, and law is, I have stories up the, and I finally decided that really the best way to frame this was really to go and walk you through the many examples of basically people who are willing to step out and be bold and push against the regulations and the laws in order to get us where we are today. But I'm going to start us to get us where we are today so that I can have the discussion of how we got to where we are today, because we're going to end at the end with a plea of what you can do to continue moving this forward. Amy Merrill is my co-director of is one of the founders of Plan C, and she will be here any minute, and she will show you a quick video about a campaign that she and the social media and the young people are working on that you could become a part of. But I'm going to start with something that's on our website. If you haven't gone to planc.org, please go to planc.org. The whole point of that website is to educate and to inform and to give you resources around access to abortion pills. So please do go to that website. But here's one of the things that we've just recently put up. Hey, Do. I hope it'll give you enough of a background that I can then lay into it right away. So here goes.
Our country is in a choice crisis, with an administration that's closing clinics, punishing providers, and effectively demanding people carry unwanted pregnancies to term. We need an option for a safe, self-managed, at-home abortion, a Plan C. And this solution exists, so why doesn't everyone know about it? Let's review. 30 years ago, a combination of pills was discovered to effectively end an early pregnancy. The health community celebrated. The world would be forever changed. The French Minister of Health even declared them the moral property of women. But when the pills came to the US, they were severely restricted by the FDA, not for medical or safety reasons, but because of politics. Today, they're used by millions worldwide every year and backed by mountains of data on safety and efficacy. While in the US, they're still held from us by the FDA, over-medicalized, even kept out of pharmacies. But this is changing. Abortion pills and information on how to use them can now be found on the internet via online pharmacies, human rights organizations, and a physician-supported site called Aid Access. All of us can play a part in bringing this option into the mainstream. 1. Demand the FDA remove the restrictions on abortion pills. 2. Spread the word. Tell everyone you know that abortion pills and information on how to use them are available online. 3. Know your rights and risks. Free legal support is always available. The solution is here. Learn more at plancpills.org.
Okay, that was a quick way. We enlisted the help of a comic strip person to try to make a really quick case of the fact that we have a solution. It should be in our hands. It isn't in our hands. And I'm going to be here today to tell you why it's not in our hands and what you can do to make sure that it gets to be in our hands. Let's talk about, I'm going to pass out, and I'd like you to just pass around and check it out and open it up. This is a packet of abortion pills, an abortion kit, a menstrual, they call it MTP kit, Medical Termination of Pregnancy Kit, that you can get online. We bought this online by going to one of the online sites too, because we're researching to see what in fact you can get and how long it takes and everything. I'll tell you more about that. But because it demissed this size to actually touch and see, please pass it around, look at it, and I'll be telling you the story of these little pills. Okay, so as it said in the thing, 30 years ago, there was a lot of noise being made about RU46, this new pill that the French Roussel Uclof firm had been designing and developing, which was an abortion pill, a pill that you could take to terminate an early pregnancy. And it started to get a lot of excitement, a lot of press, and right away, the right, the anti-choice people recognized that this was a potentially transformative product, and they wanted to make sure that we did not have access to it because it would probably transform abortion provision. So right away, they started putting pressure on the companies, the two companies. RU started for Roussel and then a German company that was also a partner company who were developing. And they started putting pressure on these companies, so much so that the companies pull it off the market. They didn't want to have to deal with the Americans who were coming in and threatening to boycott their products and bring the politics of abortion to their country. These were big, especially the German company was a huge company that owned a lot of other products, and they were not interested in getting involved in abortion politics, so they pulled it off the market. That was the beginning of the resistance and the beginning of the fight, the advocacy that had to happen. And I'm telling you this because you're going to see, I hope, a line of that we'll be tracing. One of them was the medical profession. I remember the date because I don't remember dates very well. My friends know this about me, but this date I remember because I had just given birth to twins. I was living in New York City, and I was working for the Population Council. And we had been planning a big conference to be doing in Rio de Janeiro. It was 1989. And we were supposed to, we had brought all these OBGYNs from all over the world for the big FIGO conference in Rio. And the news hit that Roussel and Uclof were pulling pulling this off the market. So because we happened to be all together at a place where we could immediately get petitions signed with literally all of the top OBGYN and advocates of abortion from all over the world, we pulled together this huge petition and sent it off to Roussel, the French company, saying, please, no, don't pull this off. This is very needed. We need this. At the same time, so that's the medical profession who, raised their hand and said, no, 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 you can't do this. At the same time, Feminist Majority Foundation, which is based here in Los Angeles, but also had an office in Washington, were into radical feminist advocacy, and they decided to get a petition from the public, from the US public, and hand-delivered this petition to the UKLAF, the German company, who was the one who was saying, we don't want anything of this, this was just a little tiny product and we don't want to be involved with this, and basically threatening to say, if you think you're afraid of the right, just wait until we get all of the people in the US to boycott all of your products, your paint products, whatever. And so the poor German company backed off and realized, oh my God, they were caught in the abortion wars of the US, whether they liked it or not, because there were two sides to this fight. And this is where we mentioned here the moral property of women. The French Minister of Health, having seen and having gotten these petitions that were coming from all over, actually came out and ordered Roussel, because France owns the way it's partly socialist, they were able to tell the company to put the product back on the market, and it's when he declared that this was really the moral property of women. That was the quote that you saw. So this is the very, very beginning. This is in the 1990s, early 1990s, right? And we're already in a huge fight where the pharmaceutical companies have a new product, but they're realizing this is going to be actually pretty controversial. It took 10 years in this country for us to finally have access to the product. And what it took, so what happened is, because it was a French and German company, Europe took on the product, began to work with the product, and made it available in their abortion clinics. The US had no pharmaceutical company at all interested in taking this product to the FDA, because again, they didn't want to be involved in the politics. They didn't see a point to doing this. So we actually had to decide to use public monies and get the Population Council, where I was working at the time, and Population Council had a big center for research where they were doing contraceptive development and developing new contraceptive methods, and had the capacity to actually put together a file and bring it to the FDA to ask for permission to make this drug available in the US. And I was at the council at the time, and I was in charge of this big initiative to prevent unsafe abortion, mainly in Africa. And I remember having to help the president of the Population Council make a case to his board of directors that it was worth taking on this product. It was going to cost a tremendous amount. It's millions of dollars to put together, and many years of work to put together a file for the FDA. And in the terms of the Population Council, which had been set up by Rockefeller many years before, the terms were that it be specifically aimed at developing countries. And so the argument that the president, who was trying to go before the board of the Population Council to say, let's invest in doing this, the argument had to be a political one to say, and this is, I remember going around and getting data and evidence from our work in Africa to make the point that if the Population Council, being a US-based organization that worked internationally, was trying to advocate for a product that had not been approved for people in the US, that we would have not only egg on our face, but a very political problem. We had done that before, where we were trying to advocate for a product that hadn't been approved by the FDA, and it was a huge mistake. It was a backfire of, what, are you pushing products on our countries that you don't even approve for your own people in the US? So it became very clear, and I'm giving you these details because I want you to understand how political all this and how it all ends up being about politics. The technology was there, but the politics was the part that was just every step of the way. And until, I'm going to fast forward really quickly to today, you will see we are still, I just had a call, the same questions keep coming up, the same fears, the same things about, can you really do this? Okay, so this now puts us in the road of, we finally get a lot of public monies from Packard Foundation, Hewlett Foundation, mainly in California, actually. Many of the California foundations funded the Population Council's work to get this file. And it took 10 years to do this. So by by 2000, file was before the FDA, and we were pretty convinced and felt secure in the fact that the data, the efficacy and the safety of these pills was so incontrovertible that we didn't think there would be any way that it wouldn't be approved by the FDA. So I want you to keep that in mind. This is what's going on in the US. Meanwhile, in the rest of the world, things are moving. So here's one of the really interesting, amazing example. Actually started in the 1980s, even before we heard about RU46. Women in Brazil who were living in a country that was, and continues to be, very, very conservative and very restrictive, and I could use other words, against any reproductive rights and access to abortion, access to contraception. It's a very difficult country. Some woman, we don't know who the woman was who did this, but somebody figured out and read on the back pocket, on the package of misoprostol. Misoprostol was called Cytoteca. Cytotec is the name of it in pharmacy. It was developed as a peptic ulcer drug. If you had peptic ulcers, you go and get this and take it and feel better about peptic ulcer. But on the back of the fine print, it said, do not take if you're pregnant because it could cause an abortion. So ding, somebody who was interested in having an abortion and who couldn't have access to an abortion, and there were many, many women dying in hospitals in Brazil at the time from unsafe abortion, took it, it worked for her, she told somebody else, who then told somebody else, and word of mouth, woman to woman, with no input from the medical community or anybody else, it got to be so prevalent, the use of this was so prevalent that it changed the public health indices, the maternal health indices of Brazil. I was a colleague of mine who's a very famous, still very well-known OBGYN who was at Sao Paulo, in one of the biggest hospitals in Brazil, started noticing that he wasn't finding as much infection happening in the women that he was treating. Most women were coming in and were dying from raging infection from having tried to do an abortion. The infection rate was like disappearing. He couldn't figure out what's going on. But he was getting a lot more women presenting saying, I'm miscarrying, I'm bleeding, I'm having a miscarriage, and then they would get treated very nicely. Unlike what you got treated if you showed up with an infection, where you would left, to be the last one treated and possibly die in the hallways. Miscarriage, right away, come in, we'll help you, take care of you, etc. So he was intrigued by this change in these statistics, and he sent out his sociologist wife to go into the community to find out what's going on here. And she found out that the women were saying they were using this thing called Citoteca. So she reports back to him, well, they say they're using this, and it starts the bleeding, and then they show up, and so he was very intrigued. He essentially sends the Citoteca to New York, where the center of contraceptive development is, and they start doing tests on this cytotec to see what's going on, only to discover that misoprostol, which is the generic name for Citoteca, has amazing indications for obstetric care. It's an amazing drug. It's used now for induction of pregnancy. It's used for prevention of postpartum hemorrhage. It's used, it can do an early abortion, as the women had told us and proven to us. So this is something we discover from the women who had themselves figured out how to take matters into their own hands. And we, meaning the scientific community, the health community, all decide to say, well, this is kind of interesting. What are the mechanisms of action of this drug versus RU46? Because meanwhile, now bringing these two back, RU46 has been discovered. And they we realize that if you put them together, the two mechanisms of action give you a really, really effective, safe, and much easier on the body abortion by putting them together. Thus, the one pill, mifepristone, RU46, followed 24 hours later by misoprostol, the cytotec. That's the discovery and the genesis of how we even found out about misoprostol. Okay, so now back to, we present the data to the FDA, and in the meantime, it's been 10 years that we're trying to get it to the FDA. The rest of the world hasn't been waiting for us, the US, and they've been moving on it. So by the time we approve it in the US, Europe has now gotten to the point where 80-something% of all the early abortions are being done with pills as opposed to surgical. They've just, the physicians have just accepted this, moved with it, and they're moving with it. And then a person, I'm giving you stories of individuals who have stepped up and gotten us to where we are. I was asked to meet with this young woman. This was by now it was 1991, 92. I'd moved back to Los Angeles. My twins were now 2 years old. And somebody tells a young woman from the Netherlands to come see me because she has this good idea and she's looking for funding. And somebody tells her, I know all the donors. So I met Rebecca Gompertz, who shows up at my house, very young, very active young physician who had been working with Greenpeace in Latin America. And she says to me, I have this idea, but I need some money, and somebody told me you could help me. And her idea was so amazing. I said, yeah. And I sent her to every donor I knew and got her enough money to start Women on Waves. So that's a whole story to itself. It isn't really about medication abortion. It's about abortion. It's about a person who can make a difference like you would not believe. But Rebecca's idea was, she had noticed that, back to law, if you are on a ship, the law of the land, of the laws that you adhere to on a ship are according to the flag that you're flying under. Now, in the Netherlands, abortion is very available, and they believe it's a human right, and it's, they have much more sane policies around abortion than we do, and than many other countries do. So she realized that she could make a big splash, literally, by going on a boat and parking her boat outside these crazy countries like Ireland, Poland, Chile, where the laws of those lands were really, really restrictive. where you could not have an abortion for anything in the world. And she essentially designed a container ship and put into it a surgical table so she could do vacuum evacuations. And she would park her boat and get a lot of press. It was really more about making it obvious that it was so ridiculous that you could literally be, go out in a motorboat from a country in which you risk dying for your abortion, get out there, get a safe abortion, get back on the boat, and be back in your country. She got a lot of press, and it was wonderful. If any of you really want to see an amazing movie, it got 2 years ago, Best Documentary, Academy Award. It's called The Vessel. I recommend it highly. You should all go see The Vessel. It's a documentary about Rebecca and about her ship and about what she did. Okay? Fast forward. The reason Rebecca is very important is because she's brilliant and she is bold as all get out. And she realizes very quickly that, wait a minute, the technology has changed and I don't really have to do a boat and go to these places to give them abortions. These pills I can mail them the pills. I don't have to go, this is way too expensive, this is ridiculous, I can reach many more women by mailing them the pills if they need an early abortion. So she sets up Women on Web. Everybody go to that website, Women on Web. And for 10 years, and now it's been almost 20 years, she has essentially served tens of millions of women all over the world who go to her website and she ships them a pill like what you just got, and she follows up with them, and there hasn't been any untoward effect, there haven't been deaths, there haven't been anything. Okay, so this is happening, okay? So back to the US, what's happening? This is 2000, year 2000, 30 years ago. We're about, in 3 months, we're talking about what we should do to celebrate the 30-year anniversary of RU46, of pills. In the meantime, in the US, what's happened is, I would come back from working in all these countries and seeing that there were all these countries in which you could get the pills shipped to you and do it at home by yourself. And I'd come back to the US and it was getting worse and worse and worse. And to be fair, when it first got approved in the US, to our dismay, they did approve the product, but they used this regulatory thing that hadn't been used before for much of anything. It was in the books, that allowed them to regulate the distribution of the pill in order to protect the women as they were trying to figure out whether or not this was safe or not, even though we had all this data on safety and efficacy. So they approve it. The FDA approves the RU46, the abortion pills, with this huge severe restriction that has been and continues to be our biggest problem. And it was strategic, and it was so smart. Because what it did is it essentially said, yes, we approve this product, but it's not going to be a normal product that goes into the pharmacies that doctors write prescriptions for and you can go get access to. We think it needs to be so regulated and careful, because we're not sure about it, that the only way you can get it is doctors who are willing to be known as being an abortion provider will have access to, will have to get it directly from the manufacturer, and only they will be the ones who can distribute these pills. So the distribution system, the normal distribution into a pharmacy, doctors write prescription, you go to the pharmacy, you get it, finished. And basically what it did is it medicalized it so terribly that the distribution system got in the way from anybody now wanting to get access. And it implied that it was unsafe. The feeling that this was a product that needed this kind of protection just fed the feeling that, wait a minute, this must be an unsafe product, that it requires this kind of careful, you know, management. So we, even when that happened, we thought, okay, well, we can get primary care doctors and adolescent doctors and everybody to realize they can just sign these agreements with the manufacturer and they should be providing this. Well, no, what happened, it was 30 years ago, the providers were fighting the good fight of clinic access. We're trying really hard to, you know, fight for making sure that clinics weren't being held back. And frankly, the doctors didn't really understand. Still to this day, many do not understand the excitement of abortion pills. I have had so many young female doctors trained at the most, you know, at UC San Francisco, at UCLA, where come out and say to me, why would anyone take these pills when all you need to do is come in and in 20 minutes it's over? I can just, you know, finish it. Why would you want to bleed for 2 weeks and not know for sure that it was done? I don't get it. Why would, you know, most people, if they have a choice, they're going to want me to do the vacuum aspiration, is what the doctors felt and still a lot feel. And what we started falling into is doctors feeling very, very protective of the fact that their role had been in the US to make abortion safe. It was doctors who had made abortion safe, right? It's all between you, a woman and her doctor. Do it yourself means, you know, backstreet abortions, you'll die. I mean, the narrative and the importance and the knowledge about safety of what's unsafe abortion and what's safe abortion all had to do with whether or not you went to a good doctor. So the doctors were not at all that excited about bringing on something that really took it out of their hands. And so it's been a long, and continues to be, that fight of fighting and making clear that, you know what, this actually could be a do-it-yourself method. You know, that's one of the things that we're working a lot on Plan C about, is really demedicalizing it and taking it, putting it back in the hands of the women who figure this out in the first place, and making it, and the excitement about the fact that this technology, one of the, you know, it's so rare that one comes up with a technology that is safe, effective, easy to use, and inexpensive. How often? That means I have 10 minutes, so because I want to leave a lot of room for questions. So thank you. You'll tell me in 10 minutes more. Thank you very much. So I'm going to now sort of fast forward to the frustration of realizing that year after year after year, we all kind of fell into place. It was like, okay, medication abortion, we're working with all the doctors to make sure that many of them at least make it available through clinics. And frankly, that's been a whole challenge. We still today, California has the highest rate of early abortions being done by medication instead of surgical. We're up to 30, some say 40%. That still means that 60% of early abortions are done through vacuum aspiration. And that is a provider bias if I haven't ever seen one. I mean, there is no doubt, because other countries have gone to much, much higher. So we still are fighting the fight. This is within clinics, okay? You understand, that's within the clinics. Even though what the truth of the matter is when you go to the clinic to get your medication abortion, they talk to you, they check how far along you are, they give you tests to make sure all this stuff. But basically they say, okay, when you're ready, take this pill, the first one, and then 24 hours later, take the other one, and then call us. Basically, you're doing it alone. You're going home and you're going to go do it. It's not being done. It is a do-it-yourself method. But the restriction of having to get to the clinic first has been critical and huge. Okay, so I'm going to back up a little, and the 30 years of frustration of seeing that the rest of the world was moving ahead, and I would go and work in these countries. I'd come back from Ethiopia, where I had been working, doing an evaluation, and I went to a Highland pharmacy, and I could get this kit that you just sent me back. I could buy it for the equivalent of $5 and go take care of my abortion in Ethiopia. And I'd come back, and that was the year that, you know, the last clinic in Texas was being threatened. And it was just ridiculous. And meanwhile, Rebecca, who had been doing her Women on Waves and Women on Web, it was going so well that there were 2 other companies, all of them based in Europe, who were now also shipping pills. So there were like 3 major companies, Women on Web, Women Helping Women, Safe to Choose, all shipping pills to everybody but the US. And every year at the meetings that we would have, the international meetings about medication abortion, I would beg, please, the US is just as needy as anybody else. Please serve us. No, why should we risk you know what's going to happen to us if we come to the US, you know, we'll get, the FDA will come after us. We don't want to risk ourselves. And bottom line is, US, get your act together. Don't depend on us to come fix your problem, which I totally understood. Okay, finally. So then I decided, that was when, partly meeting Amy, who I told you about and who just came in and who I'm going to let you talk to at the end, we just decided we got to start letting people know that there's this discrepancy between the rest of the world and the US, and that it's all about politics. It isn't about technology, that there is this possibility, and why is it that we don't have it here? So we decided to put together a website, and because I had met Amy just over breakfast, and she had mentioned that she worked on websites and such, and then when we decided we were going to do this, I called her up and said, Amy, you want to join? Can you help me? And we started planc.org website to share information. From that moment on, the amount of fear that people, and this is when I mentioned at the beginning that I had a call from a journalist from Vice, who keeps doing stories, and we're in the newspapers all the time now. That's one very effective thing we're doing. But her question was, aren't you scared? Aren't you worried about what's going to happen to you? The amount of fear that is around this issue for everybody about even daring to talk about the fact that we should have access to this has been pretty shocking. I had been working on the Mexico City policy internationally for all my years, and I knew what fear was, you know, for lack of losing money and all this. But the amount of fear that still drives this, and anybody who tries to do anything, is pretty shocking. When we first decided to put up this website, it took us a year of having the lawyers, California Women's Law Center, and many of the other advocates, women's advocates, do enough of a background check to finally come up and say, and write something that we could give to our donors that said, well, according to us, the lawyers, when we look at this, after all that, I guess they do have a right to speech and to sharing information, and this is all they're doing is sharing information and doing research. They have a right to that. Yes, they can do it. It took a year before a donor finally, very, very surreptitiously, without being anonymously, gave us enough funding to start the website. That was the beginning. There have been so many examples. I'm going to fast forward because I'm about to get the second wave here. We started noticing that actually there were websites that said they'd ship us the pills in the US. Even though that was surprising, we thought, really? That's true? Is that right? So we started buying off these websites, and we started noticing there's quite a few of them. And we decided to do research on it to figure out how long it takes when you purchase it, how much information do you have to send to this place. Then you're sending to India all your banking information and thinking, what am I doing here? This is exactly what I've been told never to do. I'm having to do this. How much time does it take to get here? Anyway, bottom line is we did this. We partnered with another organization because right away everybody who heard we were doing this, Planned Parenthood, everybody was like, oh my God, you can't buy online. You don't know what you're getting. It could be poison pills. Big warning signs on their websites. Do not purchase pills online. You don't know where they're coming from. Well, we did the test, and guess what? They were all what they said they were. They're coming from India. India is making so much, many of our pharmaceutical products with very, very good manufacturing practices. And that little packet that you see in retail value is $5 in India. If you can get your hands on it, if you can fly to India, it's $5 if you can go there to get it. So I'm going to give you a couple of numbers of what's happened to the rest of the world and what we think has happened now in the U.S. in the last couple of years. Rebecca, she shows back up. Rebecca agreed to come and serve the U.S. By that, she started a new website called Aid Access, so it would be separate from her Women on Waves, but it's the same thing basically, but it's a separate, so nobody can shut down Women on Waves. And she started shipping pills to the U.S. and right away, as soon as we knew that she was doing, we helped her test her site and all this kind of stuff, she became high on our report card. Because we had, in the meantime, decided we better let people know what we now know, which is these products are actually the real thing. And if you don't have any other options, you can, this is, if you're going to go online, here's what you need to know. And we did a report card. We sort of thought, hey, if you're buying a refrigerator, you go to Consumer Reports and you know what you want, a big one versus a small one. Here's what you do. If you're thinking of buying pills online, go to our report card. We'll tell you what we've learned so that you have an easier time at it. Meanwhile, because Rebecca agreed to start shipping, she became the top of our report card because we knew who she was. The product she was a product we could vouch for. She agreed to do it for under $100. We were watching the price go up and up on these other websites because the demand was there. They were starting to start $300, $400, $500. There's some that are asking for $600 and $900, crazy amounts on the web. She asked for less than $100. So we then started getting a lot of flack for doing online ordering, which is illegal according to everybody. We discovered one other person, and this is because it's about law. I want to tell you this just hit the news last week. There was one of the websites was called Macrobiotics Donor. That was the name of the website. Okay, that was interesting. We go looking, and sure enough, Macrobiotics Donor is a woman blogger from New York who's blogging about everything, including her son and on her blog, on her stuff that she sells, she's selling marijuana and all sorts of interesting products, misoprostol being one of them. And very quickly, she, I guess, sees that she switches from misoprostol to the MTP kit, to the actual kit. We're thinking, wow, this is kind of interesting. And she's like out there telling us everything about herself on a blog. So we're following her because the next thing she does, she's having trouble. We're trying to figure out how long it takes when you go to a website and get it sent to you. And hers was coming right away. She was shipping from the US. So you got it there in 3 days. Whereas the other ones were coming from India, you could take 2 weeks. Okay, so I'm going to end it and you guys can ask me whatever question you want. Anyway, I'll tell you, I'll finish with Ursula. Her name is Ursula. She's unfortunately for her now in the public arena because, so one of the things that she did is she started posting her inventory. She would start running out because there was such a high demand for this that her inventory would run out. So she's trying to be a good, for consumers, she's posting online her inventory. So we're keeping track on a daily basis what her inventory is because we're trying to guess how many people she's serving, right? And she's on the top of our report card. Now Aid Access on top of our report card. 2 things happen. One, Rebecca Gompertz gets a letter from the FDA. Read about it on our website. I don't have time to go on to it a lot, but she gets a letter saying cease and desist. What you're doing is illegal and we're coming after you. Poor Rebecca. I spent hours with her on the phone for about a week, But I knew Rebecca wasn't going to wasn't going to take this one lying down. And sure enough, after we put her in touch with lawyers in the U.S. that we could help her and everything, she decides that she writes back to the FDA, sorry, you have no jurisdiction over me. I am doing what is according to the laws of my land. I have the right to do what I'm doing. I'm a doctor, and anybody who needs my help, I'm going to help. And by the way, when I look at your laws, I actually think that your laws and your restrictions are actually against the human rights of my clients, so I am taking you to court. And there it stands. Rebecca now has a lawyer. We know him well. We keep giving him information. We don't really know what's going to happen with this law case, but basically it is now in the law about what's going to happen. In the meantime, we now have data on how many she served. In the 6 months that she was up before she got her letter, I think she sent out 7,000. She did 7,000 abortions by people who went online. And we're interviewing, a lot of those women have been willing to be interviewed. There's going to be data and articles about why people chose that route and who are they and what. But they came from every state in the union. It wasn't just the states that don't have access. There's a lot of people from California, from New York, etc. That was the story of where the law now stands with aid access. The other one with Ursula is we were thinking, wow, we didn't know her name, but we knew she was blogging and was very available. And we had put her in touch with journalists, and if you want to read her story, it's in Mother Jones. So go to Mother Jones and Abortion Pills, a really interesting story about her. Unfortunately, she got, the FBI came and took her computer away. This is about a year ago now. Took her computer away. And was waiting. She was waiting to be indicted. She was finally indicted. And just last week, we heard that she plea bargained. We don't know for how much or what, but for the case, for a situation like this, probably a good thing for her because they were threatening her with 5 years in jail and $250,000 something. And unfortunately for us, it's like an NDA. It's like now that she's plea bargained, nobody's going to really know what happened. It's not going to be taken to court, and probably she could have won, but I can't blame her for what she's done. Anyway, you read about that. That was in Newsweek, the fact that just last week they finally indicted her, that she plea bargained. We don't know for how much. We were worried that she thought that we had gotten her into trouble. But we found out that no, unfortunately, the reason they were able to come in and confiscate her stuff is that some guy, you probably heard about this case, or maybe you didn't, in Florida, had bought pills off her site and given them to his girlfriend, who he was trying to get her to abort. So there was a case against him. The police came in, got his computer, followed to her, had a reason because it was a criminal case to come into her house and get her, and that's how she got. So, did I even work up? Do I have time for questions?
You have time for questions.
Yeah.
We have time. We have to be out by 1, but you absolutely have time for questions.
Okay, let's have questions, and then I'd like to just end with, can you come up here, Amy, and get ready for, we have a two-minute campaign thing that we want to share with you.
Please, questions while we're doing that.
Yeah, it should be in here.
Yes.
Yeah. Questions, please. Ellen.
Yeah, thank you. This is amazing. What is PlanC.org doing with the medical community to kind of increase, the support and championing of this? And even though we want to remove the medical from the process, but it is so critical. And I work with adolescent medicine folks who are really strong proponents, but know very little about it.
This is not a planted question, even though it's coming from my best friend. It's a really good question. Thanks, Ellen. And I'll pass this for anybody who wants it. We wrote a piece in Stanford Social Innovation Review. This is what we're trying to do with the medical. We absolutely need to get the doctors on board to be supportive of the self-managed. we do believe that it needs to be outside of the hands of the medical system to really recognize that this is so safe and effective, that these should be over the counter. But in the meantime, until we have a model in which doctors are the ones who are doing what Rebecca's doing here in the US and not making it be part of this, you know, underground, sort of illegal system. So we came up with this project in California that we were going to do. It was going to be called the California Home Abortion via Telemedicine Project. And this is written up in here, so you can get pieces of it. It's basically reproductive health care by mail. And we had a provider in Washington, in San Francisco, who was willing to do it. We were going to do it as a study and study the impact of doing this and finding out that, in fact, it was safe so that we could make it be mainstream, that other doctors could go on. Once again, the FDA steps in, partly because our partner, Ushma from UC San Francisco, really believed that the FDA would give her permission to do this study as a study with an IND, and the FDA has refused to give her permission, and so she's stuck dead in the water in California. She's actually speaking at UCLA at 5 o'clock today on the whole, some of you may know about this AB, what is it? Somebody know, number 24 or something? A bill that has been passed in California to make sure that abortion pills are available to all the UC campuses and in UC. But anyway, because it got stopped, we are now in another state. I can't tell you yet because there's going to be a big press release, but we're about to go live in another state with another clinic who is going to do this, and we're going to wait to see what letter the FDA sends them, and then take it to court because we know it won't stand up. I mean, but given where we are in this country with the judicial system and the administration, it's going to be an uphill battle most likely. They're going to try to stop it, but we really believe that they don't have a leg to stand. There is no scientific evidence that makes this. So we're hoping, actually in some ways, we're begging for a court case. But we're also hoping that we can show that it's feasible and wanted and people really want this. So we thought we would be announcing this February 14th, Valentine's Day. A little bit of a delay, mainly because of technical glitches of how hard it is to put up this kind of website and make sure that we don't have a case of Ohio in our hands where we have a new website that says I'll get you pills and then it doesn't work. So we postponed, but soon there will be a big media splash. And we hope that, you know, to your point, Ellen, that once we do it in one place in the US, everyone else will step up. There is no reason that your doctors at Children's could be doing this if they're willing to sign an agreement with the, you know, but we're going to mainstream this. So, yeah.
So I have a question, which is that states are putting in more and more restrictions on access to abortion legally, right? Are there any states that have now tried to restrict access by mail? Or is that still a great place to play with?
They're definitely trying to stop telemedicine. So telemedicine is some way, like Planned Parenthood's really working towards telemedicine and stuff. And there are telemedicine laws going up, regulations going up in states every day. They're onto that. The bit about the mailing is not yet quite clear because doctors mail products all the time.
That's
right?
what I was thinking. That's exactly what I was thinking.
Right.
Okay, yes.
Right, and in fact, that's why it's sad that Ursula plea bargained. It's not sad, she's protecting herself. But it would be good that, because what did she do wrong? I mean, you know, there are sites that will send you Viagra that are doing the exact same thing that she was doing. It was an approved product, it was, you know, so,
Okay.
yeah.
Any last questions? Yes.
Yes.
What's so fascinating about the story is that you have something which begins as a classic form of self-care in Brazil, where it is the individuals actually separating themselves entirely from a medicalized model. There's a pill, but it wasn't for this, and they have access and use it and have the results. Now it's an interesting hybrid because you're fighting a legal restriction on access to abortions, of which this is one method, but you are still talking about this as something which is given within a medical context. And I gather there's some tension among supporters of it as to whether the push should actually be to the next step, the Brazilian step, in effect, to say an Ursula who's not a doctor, as well as Rebecca, who is, would be able to dispense this.
Absolutely.
And so how do you negotiate that at the same time that you're reaching out to doctors and say, we want you to feel comfortable and to prefer this for your clients who want it? I mean, if a woman says, I want a vacuum
Right.
method, that's
Right.
fine, but.
Absolutely. No, thank you for that. Absolutely. The part that I hadn't even mentioned until Ellen asked this part about doing with is because it is going back to the medical model, which we don't think is where we should be. Ultimately, this needs to be over the counter. That's what's going to happen to have it mainstream really in this country. Over the counter product.
Like the abortion, I mean, like the pregnancy test.
Like or like emergency contraception.
Emergency
We worked for so many years on the advocacy to make emergency contraception over the counter. And it really took an amazing amount of advocacy to get there because of all the politics of it. This is the same.
It took a few congressmen's daughters.
And to your point, I mean, Congressman, when Hillary Clinton was Congresswoman and what's her name from Washington State, they refused to allow the FDA commissioner they refused to approve the new FDA commissioner until they got off the, and did something about the file that was sitting on their desk. That's how political that one was. But to your point, we do believe it should be over the counter. But we want to give it the kind of validation of knowing that there are many physicians who do really truly know and believe that it's so safe and effective that it can be done without that. So it is a fine line. And we have partners who do not like our approach at all. They do not like our approach. They want to be, there's some that want to be really underground. It should be women helping other women, tell them, use misoprostol only, go back to using the one that you can get because it's, we just feel like that's not good enough.
More pragmatic.
Well, more pragmatic, also more angry. It's like, come on, why should we have to be under the radar with this? This is, it's both. It's absolutely both.
So we need to cut very soon.
Yeah.
So
Yeah.
do you have, is there a question?
Yeah, there's one more, Valerie.
Okay, one more question and then, yeah.
Well, I just wanted to kind of make a statement to what you said earlier. I actually accompanied a young woman to one of these centers to have an abortion. And you're absolutely right. It really should be over the counter because the time that they put in with her was nothing. She still left with pills to take.
Yeah.
And then a return for more pills to take. And she was totally on her own. And I couldn't even go in the back to see what they were really doing, but she said they did nothing. So 100%, those centers are pretending to do all this care, and they really aren't. They're just instructing people to take pills.
Thank you. Yeah.
Thank you, Valerie, absolutely. And everybody who's experienced that, either through a friend like you or themselves, the second time around, it's like, what? Are you really going to make me come and get an ultrasound, get a blood test, wait 3 weeks? It's like, come off. Give it to me. Give me the pills. So that's a big drive of this. I think we don't have time.
Oh.
Is that the one?
Our country.
Yeah.
No, we already watched this one.
Oh, I'm sorry.
It was the
I'm
other
not
one,
sure
the
which one you
campaign
mean.
one. It's okay, I think we probably don't have-
Okay. Sorry.
Go to the website and please look at the one that's the
21st
21st century
Okay.
campaign.
And I also have flyers. I'm Amy Merrill. I'm the digital director of Plan C. I have flyers here if you want to grab one. And we also made these cards that are like a keep in the back pocket and hand to someone who asks about this or you have a conversation about this. Just a little info card that you can take a few of if you're interested.
And can you all join me in thanking them for this?
Become a part of this. It's really important that you know and you share it with someone because you or somebody you know is the next person who needs to have this in their hands. So this has got to get out. Please. Thank you.